So I was doing my usual reading and I found an article that said an anti-parasitic drug kills COVID-19 in lab. And I looked again and I said, is this for real or is this fake? But this article came out a day ago and it's by a Christine McGinn. And I'm going to read it again so that you see that I'm not making this up. So I came across this article and it says anti-parasitic drug kills COVID-19 in the lab. So when I read this article, it not only kills COVID-19, but it also kills something else that's really important that had also pretty much killed a lot of people in history as well. Another virus that was a biggie. So let me read this to you. Okay, so I guess there was a video. I don't know if that video was related to this article, but it doesn't play. But I'm going to read this article and you can tell me at the end what you think about this whole thing. If this is, what this may play out to be. But I personally think it's going to be a fiasco because I already feel that there's a lot of people, and including myself, that distrust the way some of these situations play out. And it usually seems as though people who are insured or people who have more money tend to be the ones that are the first pick to get access to life-saving drugs. So it says an anti-parasitic drug available throughout the world has been found to kill COVID-19 in the lab within 48 hours. A Monash University-led study has shown a single dose of this drug, it's ivermectin, it could stop the SARS-CoV-2 virus growing in cell culture. So we found that even a single dose could essentially remove all viral RNA, effectively removed all genetic material of the virus. By 48 hours, and that even a 24 hours, there was a really significant reduction in this. So within 28 hours of that 48 hours, you can see it removing that particular virus. And Monash Biomedicine Discovery Institute, Dr. Kylie Wagstaff said on Friday. Okay, so this is this virus that has already pretty much put the U.S. on edge and has killed more than 65,000 people in the U.S. and more than 1.1 million have contracted this virus. There has also been people who are still contracting it, and there's a lot of fear, and the stock market has gone crazy. The housing market may collapse at any moment. People are not able to pay rent because they have lost jobs. Unemployment is skyrocketed, all behind this virus. And here they're saying there's an anti-parasitic drug that kills COVID-19 in the lab within 48 hours. Wouldn't you believe? So a Monash Biomedicine Discovery Institute, Dr. Kylie Wagstaff said this on Friday. And within the 24 hours of the 48 hours, you can see the difference from a person that's been infected that receives this life-saving drug. Now, I'm going to read more into this, and you're going to see that this is, wow, amazing, because let me go further. While it's not known how ivermectin works on the virus, the drug likely stops the virus dampening the host cell's ability to clear it. The next step is for scientists to determine the correct human dosage. Okay, so that's what they're supposedly working on. To make sure that the level used in vitro is safe for humans. So all the beaches are closed, all the parks are closed, a lot of shops and stores are stressing that people where a lot of shops are closed, and a lot of grocery stores that are deemed as essential stores are now on edge because there's more death and there's supposed to be a wave coming where there's a peak on this virus. But yet, I found this article, as I do many articles that are amazing to me, because I'm like, well, we should get on this. We should really try to work hard on this to try to see if we can distribute as much of this medication as we can, right? Let me read more about this. So in times when we're having a global pandemic and there isn't an approved treatment, if we had a compound that was already available around the world, then that might help people sooner, Dr. Wagstaff said. Realistically, it's going to be a while before a vaccine is broadly available. Let me read that again. Realistically, it's going to be a while before a vaccine is broadly available. What does that say to me? What would that say to you? Broadly available, meaning available to people who are uninsured, available to people who may not have a lot of money, or who may not be in serious condition, but they have the virus, but it could be that they're a carrier and they still need to be treated, because you don't want this to turn into something where it starts all over again. Before ivermectin can be used to combat coronavirus, funding, here we go. Funding is needed to get it to the preclinical testing and clinical trials. Ivermectin is an FDA, Federal Drug Administration approved antiparasitic drug, also known and shown to be effective in vitro against viruses including HIV, dengue, and influenza. So the study is the joint work of the Monash Biomedicine Discovery Institute and Peter Dodry Institute of Infection and Immunity. The study findings have been published in Antiviral Research. Okay, so that's the article right there. And when I saw this, I don't really see a lot being said about it, but it has been trending. Some people have kind of ran across it. I was one of those people who ran across this article. Now, what I was going to do was look at this. There have been coronavirus layoffs that disproportionately hurt Black and Latino. That was one issue that came out. How racial health disparities will play out in the pandemic. And that is the other article that I was also looking at. And so, how racial health disparities will play out in the pandemic. And what I was looking at, and this is in politics, Dr. Uchi Blackstock explains how coronavirus will affect Black patients and why that terrifies her. So this is by Julia Craven. And so this is a doctor. This is out of the Slate. Uchi Blackstock. Heather Sten took the picture, of course. And so this was March 30th, 2020. So this is fairly recent. And so I'm just going to get into this. The federal government has failed its populace in many ways, okay? So, since the COVID-19 pandemic reached American soil, it began early on with an inadequate supply of the test kits being provided to clinicians, compounded when the Centers for Disease Control Prevention enacted strict criteria for patients who could receive one. So remember back when they said they didn't have enough test kits, and then you hear people back and forth, politicians and people that are in the White House, stating that only people who show symptoms should be getting tested. Then we're hearing conflicting stories or arguments that there are people who are pre-symptomatic and asymptomatic, which means pre-symptomatic that they may be in the beginning stage of showing signs that they might have been exposed to coronavirus. Some have even gotten tested and the tests have come back negative, and then they retest and the tests come back positive. And then asymptomatic people who don't show signs of being ill. They don't feel sick, they don't have any cough, no dry cough, no fevers, and they don't have any other symptoms that point to an obvious conclusion that they may have been exposed to coronavirus. Even though they could be carrying the virus, they could have been exposed and they may have the virus and they carry the virus. It doesn't affect them in the deadly manner that it does others, but they then carry the virus assuming with the assumption that they don't have it because they don't show the signs of illness, and then more and more people get infected. So it's stating that Dr. Urge Blackstock notes that the discriminatory effects were embedded into those criteria. So the initial CDC recommendations discouraged doctors from testing every patient who came in with a fever, coughing, and difficult breathing. So that was a biggie. If you had difficulty breathing, fever, coughing, those were the three main symptoms. A test, they said, should only be performed if those symptoms presented in someone who had recently traveled. That was the other thing. If you recently traveled to an area where COVID-19 cases were prevalent, or if they had come in close contact with someone who had already been diagnosed with coronavirus. Okay. So in Brooklyn, urgent care centers where Blackstock does part-time clinical work, she says that she noticed early on that most of the patients who were answered yes to those two questions were affluent white people. And I'm going to add to this. Most of the coverage that we're seeing, people, they were on cruise ships. They were people who had more money, you would assume, because you would assume they have more money if they can fly back and forth, if they have a business, if they have a job where they can work from home, as we see. That's even becoming a big thing because most of the people who can't work from home are the lower wage earners. They have to actually be at a place of employment to leave their home and go and do the work outside their home. They can't just go home and work from home and still receive a paycheck. And so those are probably the reasons why unemployment has skyrocketed. So we see what's going on here. So even in the medical sector of this, we see that the people who are getting tested or who are showing symptoms are the people who they have access to travel because they have the means to. And the majority of her black patients would say no because they're not getting on planes and flying every week unless they have a job or that requires it, or they are somebody that has a whole lot of money and they could just be flying all over the place and taking cruises. And so we got all of these patients who would come in and had flu-like symptoms but didn't have the flu. And they probably had COVID-19, she told Slate. But we weren't able to identify them because the criteria is already biased. So already they have started doing this with the medicines and with who gets treated, who gets the treatment. Blackstock is an emergency medical physician by training. So she was in the academic medicine for about 10 years until she left in December to focus on her company, Advancing Health Equity, which partners with healthcare organizations to make sure that they have the tools needed to provide equitable care. And so her academic and clinical experience have led her to conclude that not only will testing patterns fall along racial and social economic lines, but Black people are going to be disproportionately affected by COVID-19 because Black Americans experience profound racialized health disparities, including high rates of diabetes, hypertension, asthma, diabetes, chronic illness, that heighten the chance of adverse outcomes should one contract the coronavirus or the COVID-19. So she also discussed environmental and structural factors that contribute to the gap in health between Black and white people. So the interview had been edited and condensed for its clarity. And so this, I believe, was an interview, and it was condensed, and meaning I believe it was shortened so that it's a little more, clear cut and dry, and so I'm kind of panning down. So I'm gonna kind of go back up and read through it, and then at the end, this will be probably the conclusion of this video, but I feel like there's a lot of uneasiness, there's a lot of fear, and there's a lot of separating even in this pandemic. So I'm going to add at the end another scenario that I just was led on to that I thought was pretty telling of what we've been going through all along, that I find to be very unfair. So this right here, it says, Julia Craven, what role has privilege and influence playing in testing? I keep thinking about the celebrities who have been tested, and I don't know if you've seen this, but there's a map of Dallas County where there are more confirmed cases in George W. Bush and Mark Cuban's neighborhood than there are in other areas. And so Uchi Blackstoff. Okay, I have no idea where these people are going to get tested or these tests. And so even myself as a healthcare worker, if I was exposed to COVID-19 and I didn't have symptoms, I wouldn't even be tested. And so I would be told to go home and quarantine for 14 days. Now, I've been hearing this, even in these neighborhoods of south of Los Angeles, even in the neighborhoods that are in the neighboring cities that are low income outside of Los Angeles, people are being told to stay home, shelter in place, and quarantine for 14 days. Or there are video chats where if they call, you don't even go to a hospital. They will turn you away because their excuse is, oh, if you go to the hospital, you might be around patients who actually have the COVID-19, so that will expose you to it. But what they're told is, even if let's say you have the symptoms or you could possibly have it, you're told if you show symptoms of this to stay home and quarantine for 14 days. And the only way you can come back is if you start having breathing problems, difficulty breathing. That's when you come back. But at that time, it could possibly be too late. So it shows the peak of our systemic inequities. Certain people can be tested so easily, and not just easily, but the tests that they're getting seem to be from companies that have very quick turnarounds. Okay, so my patients are waiting 5 to 7 days to find out. Okay, so for 5 to 7 days, you're asking someone to self-quarantine at home. Don't go out and minimize exposure to other people. And these people have jobs. And one thing I've noticed is that a lot of my Black patients work for the city, and they are essential employees. And they're bus drivers, they work for the transit, and they can't really afford to be out of work anyway, and they still have to work. And they don't have the luxury of working remotely, which means working at home. And so when I tell them it's 5 to 7 days, they're like, what am I supposed to be doing in those 5 to 7 days? And I'm like, I'm sorry, you're going to have to stay home. Okay. So the map of Dallas is very enraging because it's not that white rich people are getting COVID-19 more, it's that they're more capable of being tested for it. So I was worried that people would say, oh no, but look, there are black celebrities who have gotten tested. And we know there are few basketball teams where the entire team has gotten tested and they weren't even symptomatic. Okay? They didn't even have symptoms, but they got tested. So also we could look at this as a classism thing. And, favorites over those who aren't, important people, VIPs. But that's to be explored in this articles, but I digress. That represents a very minuscule percentage of the black folks. And so the fact is that most black people will not have access to the sort of ease in testing. So one thing that scares me about this whole thing is especially with the limited testing and people getting really, really sick, and just the people that are getting sick. It is the doctors that don't always take black patients seriously, and they don't always listen to us. What do you think is about to happen in hospitals if doctors have to start triaging resources? Think about that. So there's so many things that we already know. And we already know that the clinicians don't really listen to black patients. And that even on the implicit association test, clinicians have a preference for the white patients over the people that are of color. And we know, even aside from the interpersonal dynamics, the way that the system works, there's an algorithm that is supposed to allot a certain amount of resources to critically ill patients, but it underestimates how much resources critically ill black patients use. So when it's time for clinicians to ration resources, I think we can already assume that black patients are going to be disadvantaged because they're not going to be listened to, and they're going to be disadvantaged because even if you say that we're going to use a certain protocol, which we're saying is objective, it's not really objective. It has bias embedded in it. And I think it's just going to compound the inequities. And so I think most people would say this thing is going to affect everybody. And yeah, but black folks are also going to be the most significantly affected. I have no doubt about this. So when I heard about doctors in Italy having to ration ventilators, and then incredibly likely the possibility that it is going to happen here, and my first thought was so many black people are going to die. So when I talk about implicit bias, I link it very strongly to structural racism because it has the same effects. Even looking at maternal mortality, we know that the basis of, or the bias is implicated in high mortality rates. So when we're thinking about rationing ventilators, which they did that in Italy, it was, from what I read, that it was so bad in Italy, so many people dying, they went through a draconian measure where if you were over a certain age, you are going to die. It's a given because they didn't have enough resources, ventilators, in other words. If you had 2 or 3 organs that already looked like they were failing, you're going to die. If whatever other reason that they had listed that would be the issue or problematic, you're going to die. Whatever their reasoning was. And so they were feeling forced to make those decisions. So in the case of this right here, so when they're thinking about rationing ventilators, the fact is that because we live in a racist society, that clinicians will have a stronger affinity for certain patients over others. So they'll have a stronger affinity for white patients versus black patients, because we've seen that even in medicine where White patients are given more medicine for pain than black patients are. And it is somehow in the minds of some people that black people do not feel pain. So even when it comes down to an assigning pain or assessing pain, I mean, it's so well documented that it's scary that clinicians of all races, and mostly white clinicians, will underestimate black patients' pain, and will undertreat black patients. And so that's basically what I said, and it was said here. Um, so when you think of someone who is dying or gasping for air, you have a black patient and a white patient, and we almost know what's going to happen just based on the data that we already have. And so, which is terrifying. Black people are also at higher risk of developing serious complications from COVID-19 because we have a higher rate of hypertension, asthma, diabetes, and are more likely to have comorbidities compared with other racial groups. And so what does that look like when we're having this conversation? So the reason why we have such high levels of diabetes, hypertension, asthma directly linked to structural racism. Weathering effect, which is when everyday racism causes a stress response that ages our bodies, epigenetics, and which is how structural racism and that chronic stress affects gene expression. And we're already very vulnerable. And when you add this pandemic on top of us, we're more likely to be sicker when we present. Okay. So then we have to worry about whether or not we're going to receive unbiased care. So it's just layers and layers and layers on top of that. So when it hits the fan, we're the ones that are going to suffer the most. And so we're even more likely to be uninsured. And now people are supposedly able to get the test for free, is what they're saying. But that's non-issue because the testing is not always widely available. And this is not going to end well for us. So what environmental, I was reading here. So what environmental factors make someone more susceptible to respiratory illness, like you said, outside of just the physical disadvantages that we have? There's the fact that we are more likely to live in substandard housing, less likely to have insurance, etc. So some of the high asthma rates are related to cockroach feces that actually can be exacerbating those factors. And also we're more likely to live in neighborhoods where the toxic dumping and there's environmental racism happening. In medical school, we're taught that we're not taught about any of this, and we're not taught from a public health perspective in most medical schools. And we're not taught about how practices and policies historically, even in the current day, have perpetuated health inequities. So there are a lot of physicians, clinicians, nurses, physician assistants out there who have no foundation in how structural factors influence health or structural racism influence health. And so, right. So are you afraid that some black people won't seek health care just because of our community strained relations with the medical system? And that is a possibility. Definitely that can happen. And I wouldn't be surprised if it did, because history is very rich in terms of how our healthcare system has exploited and abused black communities and black people. And I definitely know that when my patients see me, there's almost sometimes a look of relief on their face. So I can relate to being grateful to see a black doctor. And what I often tell my patients is, please, if your symptoms worsen, anything changes, please come back. Because I also know that they probably are used to clinicians not taking their concerns seriously. And how can the people involved here, clinicians, governmental officials, and others, address the structural factors that contribute to racism in healthcare? It has to be top of mind when you're thinking about testing criterions, about practices and policies that are put into place, and even thinking about which hospitals Black patients are more likely to go attend to or go to. Making sure that hospitals have the resources to adequately care for critical ill patients is key, so they don't have to transfer a patient out. Being proactive and thinking about which communities are going to need more, and thinking about how you provide equitable care and resources to different communities. So you had some patients who came in and they tested negative for the flu or other things, and you could have had to deduce that they had COVID-19. So what were the conversations like, and how do you feel having to tell these patients, hey, I can test you for this? So it's the worst feeling ever, because I felt the weight was on my shoulders, telling patients that I know you deserve this test and we should have had this test for you. Obviously, I can't say all that, but it's a most horrible feeling. So I'm trying to figure out, how do I have that conversation with each patient in order to explain to them that, yeah, there's a test that you should be having and that you deserve to have, but we don't have enough resources for it. And I have a limited number, and I have to really be thoughtful about who I give the test to. But I know that's what's going on with you is important, and I know it is worrisome to you, and that's why you came here today. And so, in terms of the COVID-19, and so it's hard. They come to us because they need reassurance. People who might even feel that they may have been exposed to it don't have access to these tests. So I'm kind of adding that in there. And they might have fear that they could, have like mild symptoms and they can't take the test because they're told to go home and quarantine 14 days. So how do I tell them in that way when they walk away and they feel reassured? And so, have there been any other circumstances where you've had to deny a patient of a medical test as frequently as you having to do it now? So no, never, never. So that was her response. So we've obviously talked about this a lot through the conversation, but why should we be especially concerned about COVID-19's effect on Black Americans? Because if you don't protect most vulnerable people in society, then everyone will be negatively affected by COVID-19. The consequences will be even more profound. And I feel like if you address education, healthcare, mass incarceration with us, if you address all those issues, you bring all of society up. So what's at stake here? Humanity. If we don't think about the most vulnerable members of our society, what kind of society are we? So we talk about the values of living in this country, but if we don't take care of each other, we don't take care of the people that really have the least, and then we are on a really and very dangerous course, especially with this pandemic. And so that's pretty much this. Now, when she mentioned this doctor in the article, when she was doing the interview and she was asked a series of questions, she was mentioned about the distrust that Blacks have had historically for the medical system. And I came across this article as well, which sheds light on to why a lot of Black people, in some sense, have a disdain reaction towards the medical field. Amid coronavirus pandemic, Black mistrust of medicine's loom. And this is by Aaron Morrison and Jay Reeves out of AP Press, Associated Press. And so the virus outbreak this goes back as far as the Tuskegee mistrust, is what they call it. There was an experiment in history that happened, and I'm going to go into this. I'm going to skip over what it's saying. So, in this March 26, 2020 photo is Ramhel Peebles walks in his neighborhood during the interview in Brooklyn borough of New York. Peebles, who is skeptical of what he hears from white-run media and government, didn't see the need for alarm over the new coronavirus. Peebles is one of 40 million black Americans deciding minute by minute whether to put faith in government or medicine during coronavirus pandemic. Okay, New York, just as the new coronavirus was declared a global pandemic, gym members in the New York City frantically called the fitness center where Ramel, I believe is his name, Ramel Peebles, worked, asking him to freeze their membership. So he, I believe, works in a gym, and he's somebody that, he was made aware of this pandemic, and he froze memberships of gyms because a lot of gyms had to close because they say that this virus could transmit through people's sweat. And so Peebles, he's 30 years old. He's a black man who's skeptical of what he hears from the news media, and the government didn't see the need to be alarmed over the virus, as it's still some people are wondering, should they trust this? So Peebles, I felt, this is him saying, I felt this was complete hoax. So he's one of the many who some people still think it's a hoax. They think the government's behind something. They have a lot of distrust. They think somebody's behind this. There's a scam behind it. So this thing happens every 2 to 4 years, and we have an outbreak or a disease that seems to put everybody in a panic. So Peebles is among roughly 40 million black Americans deciding minute by minute whether to put their faith in the government or medical community during the coronavirus pandemic. Historic failures in government response to disasters and emergencies, medical abuse, neglect, exploitation have jaded generations of black people into a distrust of public institutions. So I've just been conditioned not to trust, said Peebles. So who is now obeying the state's stay-home order and keeping his distance from others when he goes out? Because all over, even in what they call quote unquote in the hood neighborhoods, they have tape when you go into these essential stores, if it's CVS, if it's a grocery store, your local grocer, to get your food, your essentials, whatnot, pharmacies, you have to be 6 feet apart from one another, and you have to stay a distance, and they keep blaring that over the intercoms. So he says that he's been conditioned not to trust. Why? Because some call such skepticism the Tuskegee effect. So let's get into what the Tuskegee effect is. Distrust linked to the U.S. government. One secret study that happened in history of black men in Alabama who were left untreated with syphilis. Black people already suffer disproportionately from chronic conditions like diabetes, heart disease, and are far more likely to be uninsured. So how the government and medical community responds to the crisis will be especially crucial for the outcomes among black Americans, civil rights advocates, and medical experts say this. So we are right to be paranoid and to ask tough questions, said the U.S. Representative Ayanna Pressley of Massachusetts, who joined the congressional leaders in asking the government to collect and release information about the race and ethnicity of people who are tested and treated for this virus that causes COVID-19. So this is already in the works now. So history has shown us that when we do not ask questions, said Presley, who is black, the consequences are grave. And in fact, life and death consequences. So the NAACP President Derek Johnson, who hosted a coronavirus town hall meeting with the U.S. Surgeon General Jerome Adams last month, said black and brown communities need reliable information about this crisis. So now that this has been deemed a pandemic, finally, I am most concerned with inequities in who provides the test. So who's provided treatment and how those tests and those treatments are administered in a way that is open, transparent, and equitable Johnson stated. And so for the most part, people, the virus causes mild, moderate symptoms, and such as fever and cough, and that's the mild symptoms. But the more difficult symptoms is when it gets into not being able to breathe, or difficulty breathing, labored breathing. But for some, especially older adults and people with existing health problems, it can cause more serious illness, including pneumonia and even death. So cities with large black populations like New York, Chicago, Detroit, Milwaukee, and New Orleans have emerged as hotspots for the coronavirus or COVID-19. Figures released by Michigan Department of Health and Human Services show 40% of those who have died of COVID-19 are black. 40%. So in the state where African Americans are just 14% of a population, that gives you a question mark. How did these people have access to testing? Were they told to stay home 14 days in quarantine? Or were they like Raheem Peebles, distrusting of the government's practices because of the long history of racism in the medical field? So those are questions to ponder on. And in many southern states with large black populations, there have been a slow to mandate statewide restrictions shown to slow virus spread. According to the U.S. Department of Health and Human Services, black adults are 60% more likely than non-Hispanic white adults to be diagnosed with diabetes, 40% more likely to have high blood pressure, and are less likely to have those conditions under control. Additionally, 2015, black women were 20% more likely to have asthma than non-Hispanic whites. And so those disparities make the availability of treatment or a vaccine urgent. So even as the virus is currently projected to claim tens of thousands of lives, but given history, people said he wouldn't rush to accept a remedy. Why is that? Because of what we just said earlier on, the Tuskegee effect. So launched, it says here, if we got a place where the government says, okay, now it's time to take a vaccine, then I'm definitely going to be skeptical of the intentions, he said. Launched in 1932 by the U.S. Public Health Services, the Tuskegee study involved roughly 600 poor black men in Alabama who were treated for sexually transmitted diseases so researchers could track its progress. The program was exposed and ended in 1972, and then President Bill Clinton formally apologized in 1997 over it, because the Tuskegee legacy has helped populate or pollute the black community's relationship with American medical science. And so a 2016 paper found the fallout included mistrust in medicine among black men, and along with fewer interactions with doctors and higher mortality rates. So in Tuskegee, where many families include descendants of victims, many residents don't trust government health information, said Luciania Dunn, a former Tuskegee mayor. So volunteers trying to get the word out and about coronavirus or COVID-19 have gone door to door distributing flyers and cartoon-like illustrations that don't look too official, she said. So we have a general distrust in this community, Dunn said. So I call it a subconscious rejection. The attitude is, I'm going to rebel against you. You people have been telling us lies for years, and why should we believe you now? That's the attitude. So in LA, Jamil Lacey helped found a public health group for black men and boys, Trap Medicine. Okay, so that educates black barbers and organizes workshops to address health disparities among their customers. So people will quote the Tuskegee experiment as a reason why black people don't trust medical care or health care. But there's so much more than just that one example. So Lacey said that we don't trust systems that have connected to white supremacy. And so we have to do the work to repair this. Indeed, Tuskegee did happen, or Tuskegee Indeed, Tuskegee didn't happen in a vacuum. And so the 1950s doctor at the Johns Hopkins used cervical cancer cells from a Henrietta Lacks, a black mother of 5, to pioneer medical advances and research that continue globally today. And Lacks, who died in 1951, never gave her consent, and her family has never been compensated for that. And so one way to begin healing the mistrust is to increase Black representation in the medical field, said Dr. Nicolette Lewis-Saint, Executive Director of the Washington-based emergency response advocacy group Healthcare Ready. So we have to make sure that the message itself and the messengers are being adopted to the appropriate audience, said Lewis-Saint. So who is Black herself, and is going to be really important that we get that right. And so this was an article that Reeves reported from Birmingham, Alabama, and both were members of the AP, or Associated Press, Race and Ethnicity team. And so I thought this article was a connection to what is going on now, because that is why there's so much so many people who feel skeptical about this whole thing. It goes deeper into a historical presence that has lingered here for many decades in the U.S. So there's not only racial injustice in terms of the justice systems, but even in the medical systems, even in the housing, even in the schools. It's deeply embedded and rooted in this country. And having said all of this, it's very concerning, and it's worrisome, and it's scary, because we're in the middle of a quote unquote what is a pandemic of COVID-19. And so recently I was made aware by doing my research that, and I know this is going to be hotly debated, that illegal immigrants are now going to possibly, the Democrats are fighting for illegal immigrants to get compensated through stimulus checks. And so just before this thing even came about, the pandemic, there was the issue of reparations. And there was this swirling talk about reparations and all of the reasons behind why descendants of slaves, which they say DOS, or people who are descendants of slaves, should be compensated for all of these things that we're discussing now, even in this short time that I've been discussing this, how racism has been deeply rooted in this country of America. So it didn't take very long for them to see that their argument is that if we're going to give stimulus checks to everyone else, because this is a great, serious situation of health, life and death, a pandemic, and people are going to be denied the right to have access to some funds so that they can be able to pay their bills or try to get through life. They found it that it was inhumane to do this to this marginalized group of people. There are other marginalized group of people that have always been fighting for the rights of these type of issues, and we've been here forever, but yet they find every excuse to not grant reparations. And so I'm going to bring that in this conversation, because no matter what happens, it seems like they just somehow out of the blue were able to put together the stimulus package of $2 trillion. But yet they had all the reason to do this because of the fear of the trickle down, how it has affected sector after sector after sector. The housing market might collapse. We might go back into the Great Depression. A lot of people are unemployed and have lost jobs. Well, guess what? There have been people who have for many decades been asking to be compensated for things and have never had their answers to their questions listened to, even though they figured out, this is why this is happening. This is our case for bringing this and presenting this even to the UN, the United Nations, and it's always been evaded, the issue of reparations and why it is imperative that a group of people should be compensated for the wrongdoings of this U.S. government. And so now we don't even know if this is yet another thing that could possibly be another thing added on top of many other things that we've experienced as people of color of a wrongdoing of the U.S. government. So I'm going to let this video go. So what do you think about this? I don't know. I feel like if you're going to compensate one group for what you deem to be as inhumane, when you look at just the case for this medical distrust in all throughout many decades in history that black people have, they don't even feel comfortable receiving anything from you because they fear that, who knows, some people even are going around thinking that you might even inject them with the COVID-19 just to kill them, just to make them sick. You're telling them to quarantine for 14 days. Don't come back until you have breathing problems, meaning don't come back until you're near dead. With having said that, I'm going to let this video go. What do you think about these issues? It just seems like it's another nail in the coffin. And that's probably an understatement. Thanks for listening.